Edema refers to the presence of excess fluids in the body tissues. In most instances, edema occurs mainly in the intracellular fluid compartment, but it can involve intracellular fluid as well. Intracellular fluid edema, three conditions are especially prone to cause intracellular swelling: hyponatremia. Plasma sodium concentration is a reasonable indicator of plasma osmolarity under many conditions. Low level of sodium in extracellular environment provide an hypotonic environment that have osmolarity less than 282 milliosmol per liter. Because fluid is more dilute outside, water will diffuse into the cell, causing cell swelling. The second cause is depression of metabolic systems of the tissues. And the third one is the lack of adequate nutrients for the cells. For example, when blood cell flow to a tissue is decreased, the delivery of oxygen and nutrients is reduced, the cell membrane ion pumps become depressed due to lack of ATP. When the pump becomes depressed, sodium ions that normally leak into the interior of the cell can no longer be pumped out of the cells, and the excess intracellular sodium ions cause osmosis of water into the cell and causing intracellular edema. Inflammation can also induce edema because in inflamed tissue, cell membrane permeability increase, allowing sodium and other ions to diffuse into the interior of the cells with subsequent osmosis of water into cell. Extracellular fluid edema can occur when excess fluid accumulates in the extracellular space. There are two general causes of extracellular edema: abnormal leakage of fluid from the plasma to the interstitial space across the capillaries, failure of the lymphatics to return fluid from the interstitium back into the blood. Abnormal leakage of fluid from the circulation involves usually following factors. The first one, there is increased capillary hydrostatic pressure due to excessive kidney retention of salt and water, high venous pressure and venous constriction that usually happen in heart failure, decreased arteriolar resistance. The second factor include decreased plasma chloride osmotic pressure that would be happened due to loss of protein in the urine, failure to produce protein in liver disease. Increased capillary permeability is the third factor that happened due to immune reactions, toxins, bacterial infections or burns. The second cause, blockage of lymph return. When lymphatic function greatly impaired as a result of blockage of the lymph vessel, edema can become especially severe because plasma protein that leak into the interstitium have no other way to be removed. Blockage may be occurred due to cancer, infection like filaria nematodes, and surgery. Most of the extra fluid that accumulates is free fluid because it pushes the brush pile of the proteoglycan filaments apart. Therefore, the fluid can flow freely through the tissue spaces because it is not in gel form. When this free flow of fluid occurs, the edema is said to be pitting edema because one can press the thumb against the tissue area and push the fluid out of the area. When the thumb is removed, a pit is left in the skin for a few seconds until the fluid flows back from the surrounding tissues. This type of edema is distinguished from the non-pitting edema, which occurs when the tissue cells swell instead of the interstitium, or when the fluid in the interstitium becomes clotted with fibrinogen so that it cannot move freely within the tissue spaces. Some examples of potential spaces are the pleural cavity, pericardial cavity, peritoneal cavity, and synovial cavities. Virtually all these potential spaces have surfaces that almost touch each other with only a thin layer of fluid in between, and the surfaces slide over each other. To facilitate the sliding, a viscous proteinaceous fluid lubricates the surfaces. The surface's membrane of a potential space usually does not offer significant resistance to the passage of the fluids. Therefore, each potential space is in reality a large tissue space. Consequently, fluid in the capillaries adjacent to the potential space diffuse not only into the interstitial fluid but also into the potential space. When edema occurs in the subcutaneous tissue adjacent to the potential spaces, edema fluid usually collects in the potential space as well. This fluid is called effusion.